One of the big misunderstandings in our field is the idea of trying to stretch out your hamstring muscles in the presence of acute or subacute lower back pain. A lot of patients will offer the idea of wanting to go home and stretch them, or have been continuously stretching them in order to relieve the discomfort. And this is a big problem in our field for a couple of reasons. The big reason, of course, is that by stretching out your hamstring muscle, although you're getting sort of reinforced by the stretch, you're actually putting the spine in a provocative position. You're rotating the hips and pelvis down and creating more pressure on the disc material. Although the patient is reinforced by the stretch feeling in their back or in their leg, unfortunately it is the wrong force, and the patient is unaware of this until sometimes it's too late. But a classic hamstring stretch would be something like this, whether you're using a yoga strap or if you're in a clinic with a therapist. And like I said, if a patient's having a back disorder and the symptoms are in their back or in their leg or in their buttock, they're going to do a stretch like this and sort of feel the stretch feeling and assume that this is correct. But unfortunately, that strain on the back and on the disc material is almost too much, and later in the day, they will often suffer more as a result. Rarely, if ever, is a hamstring muscle so tight that it is actually affecting the line of pull on the spine. So it's a big misunderstanding and is a bad exercise in the case of acute and subacute back pain.